Oh guys, she's waking up, she's waking up. Hi, my name's Amanda. I'm gonna be your nurse today. So you are currently in the hospital right now because you did end up having a stroke, okay? But don't worry because we ended up giving you some Alteplase to help you. How are you feeling?
A little confused. What happened?
So like I said, you did have a stroke, which means that there was a blood clot actually blocking the flow to your brain. So we gave you Alteplase, also called TPA or Activase, which is a blood clot busting medication. So this helps actually restore blood flow and prevent any further damage that could have happened from that stroke. It can also be used for heart attacks, deep vein thrombosis, so blood clots in your calves and legs, and then also massive pulmonary embolism. And then you can also use it to clear IV, central lines. But you don't have any of that. It's actually, just the stroke. But luckily we were able to give you that medication, just in time.
Explain the benefits.
So there's many benefits. So when people do get the Alteplase, for strokes, especially like what you unfortunately, had, it actually improves your speech, your movement, and your brain function after treatment for a stroke. So if it's used for a heart attack, it improves your blood flow to the heart and reduces the risk of heart damage. If given for DVT, and remember those blood clots in your legs, or pulmonary embolism, so for your lungs, it helps prevent complications like blood clots traveling to the lungs. However, recovery can still take time and additional treatment may still be needed.
How was this med given?
So we actually gave it through your IV, so in your arm, and then the first part is given by a quick injection, so pretty quickly, so that way we can get that medication to you, relatively fast, so we can kind of reverse those symptoms that you are having. So with Alteplase, it's most effective within 3 to 4.5 hours after a stroke and within 2 hours for a heart attack. And so as pretty much we need to get it, to you as soon as possible. So that's why they ask a lot of time, when was the last known? So when was the last time that you weren't having any signs or symptoms?
What are the side effects?
So some of the most common side effects actually for Alteplase is going to be bleeding. So because it's that clot buster, like I said, bleeding is one of the biggest things. So like from your gums, your nose, you might, see bruising easily. There might even be blood in your urine or your stool. And then also severe headaches, which can be a sign of brain bleeding. So that's why we have to monitor you, and that's why you're still in here for right now. Now, things to obviously tell me right away as soon as possible, or your doctor, it's going to be things like sudden weakness or numbness, severe headaches, confusion or trouble speaking, unusual bleeding or bruising, chest pains that don't go away, and then also shortness of breath. And then, so what we're gonna do, like I said, we're gonna keep you here for a little bit, and pretty much what our protocol is gonna be is we're gonna make sure that we're checking your vitals constantly. You're gonna be, as you can see, all those stickers on your chest right now, so we're watching your heart to just kind of make sure everything's still good. And then again, the anticoagulant therapy, we're gonna keep that going. Especially if you have the DVTs. And then also we're going to talk about a little bit more, like lifestyle changes, possibly like, dieting or exercise and, things to kind of improve your health overall, because obviously we want you to continue being healthy. And then also medications. So, to prevent any future clots or, issues, doctor's probably going to order you some heparin, possibly some aspirin, and in essence, blood thinners. But you're doing great, and we're here to support you through your journey to make sure that you're okay. Do you have any questions?
Will I need to take this medication again?
So Alteplase is given in only emergency, situations. So like this stroke, or like I said, a heart attack or blood clot. However, your doctor may prescribe other medications for future clots. So we'll go over everything before you leave the hospital.
Thank you. I'm glad I got help in time.
Oh, you're so welcome. I'm glad I could help you. And, if you ever notice signs of a stroke like sudden weakness, confusion, trouble speaking, or or signs of a heart attack, like again, that chest pain, call 911 immediately, because like I said, that time is crucial to make sure that you get that medication in time, okay?